Hello, this is Dr. Rodney Anderson. I am President and CEO of Family Care Network, and I have with me Dr. Jim Hopper, who is our Chief Medical Officer. We decided to start a new segment where we will answer questions that have come our way through our clinics around the coronavirus, COVID-19. And so we're going to do a series of video segments, each answering 5 specific questions. So we'll go ahead and dive in. So the first question is, Jim, are Family Care Network clinics open?
Our clinics are still open and will continue to be so. You can notice some changes going on. One, we've moved a lot of visits to telemedicine visits. We are working hard to try and make sure our clinics stay safe places for our patients to visit.
We are also, we've adjusted the lab hours and locations where our labs are currently open. We're also currently trying to figure out ways to allow folks to get routine labs for routine chronic disease in a way that is as safe as possible for them, that reduces their risk of exposure personally or their risk of exposing others. So more will come on our website over the coming weeks as we get into that.
Many people ask, should I get tested for COVID-19?
Yeah, it's a great question. As many of you have probably heard in the media, there is still a significant shortage of testing supplies, which has necessitated us being really specific and judicious with our use of those supplies. So as it stands currently, folks that should be tested, the recommendations are folks who are high risk. So those are folks who are over the age of 60 or have other significant underlying health conditions, who have worsening respiratory symptoms, or healthcare workers or first responders are really at the top of the list in terms of who ought to be currently tested. As always, we would defer back to your primary care physician to make decisions as to whether or not you should be tested. So if you do have questions or concerns, reach out to your regular doc and they would give you the appropriate answer. Next question, how does the coronavirus spread?
Well, the coronavirus is spread by respiratory droplets from people who are infected. What is important to know about that is the primary dispersion of those droplets are onto surfaces. And these, our hands, are our main route for getting the virus into us. So careful hand washing, use of hand sanitizers, sanitizing high-touch surfaces are some of our key approaches to preventing spread. What would you say, in answer to the question, what can I do to reduce my exposure to COVID-19?
Great question. So that's a perfect extension of understanding first how this virus is spread. So recognizing that it is spread through respiratory droplets, and just to be clear, that doesn't mean the air I breathe unless it has mucus droplets in it. So if I cough, sneeze, if I rub my mouth, if I rub my nose, rub my eyes, these are all mucous membranes where this liquid can be transmitted. And so if my goal is to reduce my risk of exposure to respiratory droplets from an infected human being, there are several steps. First is social distancing. So you'll notice Jim and I are sitting about 6 feet apart. That's because me speaking at Jim, the droplets, if there are any that come out of my mouth and speaking, aren't going to get to him. They are simply going to fall to the ground prior to getting that far. Second is hand washing. Again, the vast majority of spread is not through the air. It's through me coughing, sneezing, rubbing my eyes, touching the tabletop. Then Jim touches the same surface and then touches his eyes, and now he's got the virus. And so hand washing, probably can't overstate that. And then there's just the general statement of avoiding surfaces that lots of other human beings have touched. And so think about shopping carts, think about door handles, think about refrigerator handles in your office waiting or workroom or lunchroom, or maybe it's the microwave, or maybe it's the credit card keypad at the store. These are all surfaces that lots of humans touch, and that's your risk of exposure from there. So now obviously if you're a healthcare worker, we take even added precautions, what we call personal protective equipment. But again, that is in the context of specifically providing care and services to acutely ill individuals. All right, next question. Is it safe to take non-steroidal anti-inflammatories, medications like ibuprofen, which is in Advil, or naproxen, which is in Aleve?
Great, saving the tough one for last.
Yeah.
Huh? So the WHO, World Health Organization, has made a statement that they are not recommending either to take or not to take non-steroidal anti-inflammatory medications. There is some indication that people on a non-steroidal anti-inflammatory medication may be somewhat more susceptible to the attack of the COVID virus, but that is only some suggestion. There's no proof at this point. We have taken the recommendation for taking ibuprofen to lower your fever out of our general telephone calls and are recommending Tylenol, but there is no known great concern for people who have taken them for other problems.
Thank you.